Hi, I'm Anthony Gosh, a consultant spinal neurosurgeon and also the lead neurosurgeon and founder of the Spine MDT, and I'm going to explain cognitive functional therapy for back pain. Well, firstly, this applies to patients with what we call chronic lumbar back pain. So that's generally defined as pain that's been around for, say, more than 3 months or so. For this type of therapy, it excludes patients who have any kind of cancer in the spine or infection in the spine, or nerve compression causing leg pain and sciatica, so specifically chronic lower back pain, but includes patients with degenerative spine disease or degenerative disc disease as well on their scan. So cognitive behavioural therapy actually applies to the majority of people who suffer with chronic lower back pain. Now, the reason I mentioned degenerative disc disease and what's actually led to this type of therapy by Peter O'Sullivan, who actually did a lot of research in this area, is that degenerative disc disease is often a description seen on an MRI scan of your spine, and it's often overemphasized as a really abnormal bad finding. The reality is it's actually a very normal finding, and I've said this before on numerous videos on my channel and on my blog, that there is no such thing as a normal MRI scan. An MRI scan is such a sensitive piece of technology. It picks up lots and lots of different things, the majority of which are not relevant. Part of being human is that the discs in our spine, particularly lower down in the lumbar spine, that are taking the day-to-day brunt of our day-to-day forces, they do wear a bit over time. If you were to scan hundreds of people in their, say, 40s and upwards who have no back pain at all, who've never suffered back pain, you will still find degenerative disc disease. That's just a normal finding in the majority of patients. So two big names in back pain research are Peter O'Sullivan here on the left, who's an Australian physiotherapist and a professor now who's done extensive research in back pain, but looked at the sort of cognitive and behavioural side of it a lot more, and Stuart McGill here, who is a Canadian kinesiologist who's done many years of biomechanical research on the spine. They're perceived by a lot of specialists as having opposing views, but that's actually because it's poorly understood. What Peter O'Sullivan says is that we've kind of over medicalized back pain and kind of filled patients with feelings of fear and generated anxiety that the pain they have is due to severe underlying problems with their spine, and especially with the advent of MRI scans and degenerative disc disease, we fill them with this fear that the spine is this really fragile structure. They're unable, therefore, to do all the things they enjoy doing, and they adopt different behavioural habits that aggravate the pain. Stuart McGill has gone down a slightly different road, which isn't opposing, but he's just gone into the biomechanics itself. And what I like about him is that he doesn't like the term non-specific back pain. He likes to find the cause. Now, it doesn't mean that that cause is a bad thing, but having some idea of it helps you find a strategy of treating it. And he's developed some extensive research and therefore developed exercises to fit each and every type of condition a patient has, and they have been proven to be quite effective. So I agree with both of them. So there are some abnormal perceptions that I've mentioned in previous videos. There's a big myth, firstly, about posture and back pain. You've got to be really careful how you sit. You've got to walk around like you have a broomstick shoved up you. The reason we slouch when we sit back in a chair or a couch is because that's the paraspinal muscles that run up and down the spine that hold it upright. They're just relaxing. We don't walk around flexing our biceps all day. Just to keep the arms rigid, that you wouldn't do that, and it's the same with the back. So you start adopting these certain behavioural things, then you're extra careful. People become extra careful when they get in and out of a car, when they're bending to lift something up. They don't do it in a natural way. They start tensing up everywhere, and that's been proven. And that's actually been proven to exacerbate and worsen back pain. People change their behaviours. Because of that, it changes their whole lifestyle. Then they start to become a bit more sedentary as a result, and then become unhealthy. And then we see common patterns that Peter O'Sullivan has looked at. People then become a little bit disconnected from the people around them as they become more sedentary, changing their behaviours. They don't interact socially quite as well. They develop low moods, anxiety, and it's quite well proven that low mood can actually exacerbate pain. So another thing that Peter O'Sullivan has looked at in the literature over the years about core strength training. This notion that your back pain is as a result of you having a weak core is also a bit of a myth, but there's a bit of a two-edged sword here. What he's shown is, what the literature has seen is that just giving someone a core strength program alone hasn't been proven to be a highly effective treatment. Sometimes it creates over tension in the muscles that support the spine and can actually exacerbate pain. However, if you've done a formal assessment of the patient with or without a scan, if you've got an understanding of the mechanism of pain, say in the acute setting, if it's come from, say, a ruptured disc, and we've proven that disc is unstable, and that's with an actual assessment from a very experienced spine surgeon or physiotherapist or any type of therapist that deals with the spine. If we've proven that disc segment is unstable, both the way you're behaving clinically from your assessment as well as having a really good understanding of the scan, then in that setting of patients, the core strength training with very specific exercises tailored to you as an individual can be helpful. And Peter O'Sullivan himself has actually released a paper showing that in the late 90s, that very specific exercises tailored to that individual patient can be helpful. And Stuart McGill's work has actually been extensive in that area. However, in the context of generic chronic lower back pain, where you've excluded all of that stuff, Peter O'Sullivan has done a lot more research and a comparative trial comparing what we call standard therapy, so that's spinal manipulation therapy, with core strengthening exercises and cognitive functional therapy. So we have to first understand that there are modifiable factors as well as non-modifiable factors that will influence your pain and behaviours. And all of these things that they're cognitive, your own personal beliefs about your spine, why you've got pain. There's emotional factors as well, such as stress and things like that. And then you've got the coping responses, social factors, related to who you hang around within your work environment, home environment. Physical factors, your actual general health, and lifestyle factors. And within this, there are, provocatives. There are things that provoke it and make it worse, and there are things that we can modify and things that we can't modify, such as genetic things or very specific diseases that we look at. Once we've identified all of those things, then we try and change these behaviours and modify them, and then we monitor you in the process of doing it. And this type of therapy, in the trial carried out, he put two groups of patients, one in the standard therapy, as mentioned, of just spinal manipulation and just a general, not specific, but just a general core strengthening program, and then the cognitive functional therapy, which is very specifically tailored to your needs. And what he found over a period of time, there was a far better response in the cognitive functional therapy group than the group that had the standard therapy. Now, it's really important to understand when physicians, doctors, specialists mention this type of therapy to a patient and you use the word cognitive, it's quite often patients feel that you're trying to tell me that this is all in my head. No, it's nothing like that at all. In fact, this type of therapy is carried out by physiotherapists. And it's often because this type of therapy is tailored to you that it's going to be more effective than just a generic prescription of a set of exercises. So whilst I keep explaining that there's no such thing as a normal MRI scan, you may ask me, well, why do you keep requesting them? One of the reasons is, as a specialist, as a spinal surgeon, often patients come to me after they've been to various different types of therapists, chiropractors, osteopaths, physiotherapists. They often feel they've been passed around. And it's very difficult, even after a good clinical assessment, even in my mind, when I'm fairly sure that there's nothing particularly wrong with your spine pathologically, At that stage, it's a lot easier just psychologically to reassure a patient by demonstrating the scan to them, showing you the pictures, walking you through it, and trying to explain that, look, all these things that we talk about, all these stupid words on the report, degenerative spondylosis, all these things, they're just fairly normal findings. And I've done videos about this on my channel. But also requesting an MRI scan can, based on the assessment you have, sometimes it can help me identify that very small subgroup of patients who might have something more going on where something else is required. That's why this video isn't a substitute for a formal assessment by a healthcare professional. Now, in previous videos, I have actually promoted core strength training. Now, that's the reason I do that. What has been shown in these studies, including by Peter O'Sullivan, is that actually one of the biggest factors that improves chronic lower back pain, rather than specific exercise or a specific invasive treatment, is actually maintaining good overall health. So if you were to spend your money on anything, if you really wanted to fix your back and you were going to invest your money in anything, don't spend it on a mattress or any expensive type of therapy or anything like this. Focus on fixing your general health. A good diet plan, if you feel you need to lose a few pounds, an exercise program of some sort. And within that, if you see any type of personal training, if you get into personal training or anything like that, within that there is core strength training. That's part of any kind of resistance training, HIIT classes, even aerobic classes. There is a core workout within that. I encourage people, I've often encouraged people to take up classes like Pilates, not so much just because of the core strengthening. It's part of a group. It gives you some form of accountability to show up, exercise, and stay healthy. And that's actually been proven to be a bigger factor in chronic back pain. But often when I do promote specifically core strength training, I talk about the McGill Big 3 exercise. I've done another video on that. That's also for very specific areas where you've got a ruptured, slightly unstable disc that's both clinically demonstrated to you from an assessment as well as demonstrated on a scan. That's usually in a fairly acute setting. There are numerous case studies that Peter O'Sullivan has demonstrated of patients with years and years and years of chronic lower lumbar back pain. Once he's ruled out the sinister stuff and just proven to patients that, look, and helps reassure them that your spine is actually quite a robust, rigid structure. It's not this delicate thing that we've been falsely made to perceive. He's demonstrated patients have a miraculous change in their life as a result of this, so it's worth considering. The unique thing about the Spine MDT is that we bring together all the different professions of spine care, so chiropractic, osteopathy, physiotherapy, pain specialists, and surgeons, all working in a network. We're the only network organisation around the country where all these specialists are overseen by a spine surgeon. And our goal, we're able to deliver this goal, finding the least invasive solution that gives you the longest lasting result. To find out more, visit our website. You can find out more about our 3-step process and one-stop clinic, as well as our very tailored packages of care and treatment programs. Don't forget to click the like button if you found this video helpful, and please subscribe to the channel. It really helps patients suffering with back pain and spine disease find useful information that I try to post weekly on this channel.